Now I want to rally around the next heart condition, which we'll get to discuss, and this is a rheumatic heart disease. So let's look at the introduction to the whole condition of rheumatic heart disease. So in summary, it's just a heart disease that is coming from an infection by the group A Streptococcus. So the infection usually starts in the throat, now spreads to the heart, causing a lot of damage, especially on the heart valves. Okay, so it's a chronic condition caused by damage to the heart valves following repeated episodes of rheumatic fever, which itself is a complication of untreated or poorly treated strep throat infection. Okay, so it's a leading cause of cardiovascular disease in children and also young adults. So it's a long-term consequence of rheumatic fever. Okay, and rheumatic fever is usually caused by group A Streptococcus. Okay, so it's the body's immune system that is basically responding to it. Particularly the heart valves are the ones that get damaged. They become scarred, they become thickened, and they get deformed. So the mitral valve is the mostly affected, followed by the aortic valve. So it affects about 55 million people worldwide, and it causes about 360,000 deaths annually. Okay, so risk factors is poverty or overcrowding, that's low socioeconomic status, then limited access to healthcare, then inadequate treatment of strep throat. That means you had a strep throat but it wasn't treated well. Okay, then how it develops is strep throat infection leads to rheumatic fever. Then there's a lot of inflammation of the heart tissues, which now involves the valves too. Okay, so there's inflammation of the valves, okay, which actually now leads to the issues. Now, issues that the patient will be facing is shortness of breath, they are weak, there's chest pains, the heart is beating somehow, do you understand? Swellings in the legs and the abdomen, that's edema. So you can diagnose it by echocardiography and blood tests just to confirm the streptococcus organism. Then treatment is antibiotic prophylaxis, medications to manage heart failure, surgical repair, or you can totally replace the valves that are basically being damaged.